and you shared a lot about public health and how you were looking for like a path in public health and communication. So, what does public health mean to you?
It is, you just posted this. I think I saw it on LinkedIn. It's either LinkedIn or Instagram, but like public health really is a calling. Anytime I'm like interviewing interns for our experiential learning program and fellows, and I'm like talking to them, I always ask them like, how'd you get here? What was your path? Why public health? It's always the same. Like people are like, yeah, I just wanted to like help people. I wanted to like leave the world better off than I found it. I feel like just certain types of people are drawn to public health. And I also think it's like a way of life. It's hard to go through an undergrad or graduate public health program and not be like moved to make changes when you really understand like all of the factors and determinants that are affecting people's health outcomes and how you could be contributing to those things. I feel like it makes you kind of switch up a little bit. Like I feel like we're a little bit more environmentally conscious than the general public, you know. We're out here fighting for social justice issues and causes more than maybe the general population, because we kind of understand and see how all of these things are interacting in a way that like other areas of study and other like majors and fields like just don't.
And you shared earlier that you knew about public health for most of your life, and then now you're sharing that like, public health is a way of life. You got your bachelor's of science degree in community health at University of Maryland. Tell us about learning about public health and then the thought process of going in for this degree.
Like I said earlier, I'm nerdy. I like to read. So of course, since before, I guess like that's a generalization, but I really do think it is true. Like before the pandemic, people really didn't know what public health was. We never seemed to be on people's radars until something horrific's going on. We're never like telling them all of our wins. They never see us when the things are working because nothing's happening, right? Like people are dying. So of course, like I had never heard about it. I was reading this young adult fiction novel. It was called Code Orange. It was about a smallpox terrorist plot in New York City and a teenager who gets caught up in it. And just a random book I picked from the library. But because it was about, you know, I had this like smallpox storyline. It mentioned CDC. It was like talking about epidemiology. And I was like in 8th grade, I'm like reading this book and I'm like, what is the CDC? What is epidemiology? Like I like remember like going into the school library after school and like Googling like CDC epidemiology. Like, what is this? And like starting like reading and being like, oh my God, there's this whole field. Like, you know, like I was one of those kids who I knew pretty early on. I was like, oh yeah, I'm probably just going to be a doctor. Like, I just want to help people. Like that. By the 8th grade, I was there. But then when I read about public health, I was like, bet, like we can help people before they even get sick. Like that makes so much sense to me. Why doesn't everybody know about this? Like I asked my mom, like, do you know about this? She was like, no. My teachers didn't know. Like I was like, okay, well, this is what I want to do. And so, yeah, so since 8th grade, I knew. So in high school, like, you know, I'm taking on my like science. I took like extra science courses because I'm like, all right, I know this is where I'm going to go. And when I was looking for bachelor's programs, I only applied to colleges that had accredited schools of public health. Like I was serious. I was like, we're going to go to the best of the best. And yeah, so Maryland was one of the schools on that list. I got a full ride there, so of course, like hell yeah, I was gonna go. But yeah, that was the path. But I know for most people, they don't discover public health and usually until college, when they're usually like pre-med or like bio or chem majors, and then they get to like a certain level of coursework and they're like, wait, this is too much. Like, no, is there something else I can do? And then they discover public health and they're like, oh, this is what I wanted all along. So
it's that organic chemistry 2 class.
That orgo. I had roommates and I remember them because they were all pre-med. And I just remember them like all on the floor with those like
Mm-hmm.
the little rods with the in there
The
building
3D
chemical
things.
structure.
Yeah.
I was like, good luck with that. Bye, y'all.
I will let y'all know that I got a solid C in my Orgo 2 class. So just if anyone was wondering. But yeah, Orgo 2 is hard. But that's truly awesome. Like shout out to you for like finding this book Code Orange and then learning about public health and like public health concepts, and then even going even further to like ask, hey mom, do you know about this? Hey teachers, do you know about this? And I think that is what we need more of, and that's why like I'm a huge advocate of the podcast that you have as well, because I think it also introduces public health topics to people in a way that is just kind of like relatable, and that's what we need more of. And to your point, it's really hard, or at least historically, public health has done a very bad job of like sharing the wins, sharing what they're doing when we're outside of a crisis. To your point, so yeah. But that's awesome. That's awesome.
Thanks.
And shout out to Full Rides.
Dude, look. I mean, like sidebar for a second, like I was enamored with Hopkins. Like you could not tell me I wasn't going to Hopkins. And I got in and I that was where I was gonna go for a minute. But then when the scholarship opportunity came up and I went to interview at Maryland for that, and I remember having a conversation with my guidance counselor, and I'm being like, but Hopkins is the #1 school